Hello and welcome to Skin of Color Savvy, the art and science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCPLive. Hosted by SOCS leaders, Skin of Color Savvy delves into the latest research, clinical insights, culturally intelligent and responsive practices, as well as other news important to treating patients of color. Today's episode will be hosted by nationally recognized dermatologist Dr. DiAnne Davis. Dr. Davis, thank you for joining us. Could you please introduce yourself to our listeners?
Sure. Thank you for having me. Hello, everyone. I'm Dr. DiAnne Davis. I am a board-certified dermatologist practicing both medical and cosmetic dermatology in Dallas, Texas. My office is Bayer Dermatology, and I have been doing both medical and cosmetic dermatology for about the last 6 years. I had the honor of training for my residency at the University of Oklahoma, after which I did a laser and cosmetic fellowship out in Salt Lake City under the directorship of Dr. Mark Taylor at the Gateway Aesthetic Institute and Laser Center. And so from that point, I have dedicated my practice to both medical and cosmetic dermatology with a focus on treating acne and acne scars and advanced laser procedures in patients with skin of color. Through Skin of Color Savvy, we're here to provide physicians and both healthcare practitioners and providers with expert perspectives on advancing care for our patients of color. Tonight, we are going to be doing a deep dive into cosmetic dermatology concerns and considerations for our patients with melanin-rich skin. And I'm super excited to be doing this podcast, and I'm ready to dive in.
Well, Dr. Davis, thank you very much for that intro for our listeners. I think your background really speaks for itself, and really excited to dive into this with you. So just to start off, as a cosmetic dermatologist, you must see patients all day long who want to look better and maybe feel better about their appearance. What are some of the major concerns you treat in your practice, particularly in patients with melanin-rich skin?
I would say probably the number one concern is hyperpigmentation or discoloration. And I think part of that is because for our skin of color patients, when we think about the concepts of beauty and what the notions of beauty are in those different communities, it really is a beautiful, even skin tone. I would say by far and large, patients with melanin-rich skin, they want to wake up, do their skincare routine, put on their sunscreen, and not have to worry about camouflaging so many of their blemishes, post-inflammatory hyperpigmentation, melasma, and things of the like. So by far and large, I have patients who come in with concerns about discoloration. They may not be as concerned about either the primary process that starts the discoloration. So again, I have a lot of patients with acne, patients maybe with eczema. They may not be as concerned about the pimple or the eczema patch. It's the long-lasting discoloration that really concerns them. And I think it's partially because it's a constant reminder of that primary process, or at least the discoloration or the unevenness of their skin tone. So I would say I treat hyperpigmentation day in and day out. I would say also, as a patient who sees a lot of, or a physician who sees a lot of melanin-rich skin, I also do treat a lot of acne. I am practicing in Dallas, Texas. The weather is hot. The weather is humid. The water may not necessarily be the best depending on where you live. So I have a lot of patients that will come in with breakouts, acne, either on the face, chest, or back. So it's actually one of my favorite conditions, medical conditions to treat. So those are probably the top two concerns I see that come into my clinic.
Right now, you've laid out some pretty interesting scenarios there. How do you go about approaching the cosmetic consultation with a patient? What are you really looking to identify and understand before recommending procedures or treatments to a particular patient?
Sure. So I think that really goes down to my two ears and really just listening to what the patient's concerns are. I always, with my cosmetic consultations, have a mirror and what I call a pointer or a cotton-tipped applicator, because I really like for the patients to point out to me on their skin what their concerns are. Like I stated, for some patients, they may come into me and what I see is their primary process or pathology, which is their acne. And I may see, some of the enlarged nodular cystic lesions, and that may be what concerns me as the physician the most. However, when I ask the patient what is their concern, they will usually point to maybe a blemish that has been there for 3 months. And they may say, I cannot get rid of this blemish. What can we do to get rid of this? And so again, I'm looking at the juicy pimple that's on their skin, and they could care less about that. And I think, again, it just goes into what may last longer or what they constantly see. So again, I always try to listen and I always ask my patients, what are their primary concerns? What is it that bothers them the most? I also may ask them when we're thinking about either laser procedures or injectable procedures, is there a side of their face that they favor? Like, do you often turn to your right side or your left side more when you take pictures or when you take selfies? And if they do, then I will sometimes ask why, because maybe it's something with what they notice on that side of their face that, speaks to them for more of their ideal beauty or their ideal features that they like to enhance. So again, I like to make sure that I give them the time to tell me what all their concerns are. And then I start to walk them in a stepwise approach on what's going to be our cosmetic plan.
All right. And now I'm curious, are you seeing patients who come to you a lot for corrective work from a previous procedure or treatment provided elsewhere? If so, what kinds of issues have you seen and what are the important takeaways from this?
So I will say that I do see a lot of patients who come to me for corrective work. I will say probably the number one concern that walks into my clinic is someone with melanin-rich skin that may have been treated by a practitioner at an outside facility with a laser, and they suffered either a burn, post-inflammatory hyperpigmentation, or scarring. And usually they're coming to me to see if I can correct the, again, hyperpigmentation or pigmentary alteration. And so again, I think this just speaks to one of the things I talk about in my consultations with patients is when I give them my recommendations, I have no problem with them asking me questions about, my training, how long have I been doing this particular procedure, my experience with skin of color, because I think it's so important because we see so many times that there are just different offices where they might be able to, or they may try to use lasers that ideally are more designed for fairer skin types, and they try to use those lasers on darker skin. And while some of them may work, not all lasers are created equal, and not every patient with skin of color is going to react the same. So I would say that usually I'm having to either do corrective work with either lasers, chemical peels, or topical whitening agents to correct a lot of pigmentary concerns that come into my office.
All right, thank you for that. And we'll get a little bit back into treatments after this, but switching gears a little bit, it's 2025. Social media is everywhere, particularly as it relates to dermatology. How does social media play into a patient's mindset when they first come into the office? And do you find that sometimes you have to maybe clear up myths, tackle some misconceptions, or reset expectations for patients?
I will say all the time. Social media, it's definitely nice to see how much that we are able to give our patients access to information that they may not have been able to access otherwise or in prior years. The caveat to that is just as you said, not all information is created equal. Not, every piece of information that's out there is going to be the proper information for that exact patient. So I will see a lot of patients, especially my melanin-rich patients who come in and they want these super aggressive procedures because they would like to see instantaneous results. And I usually have to tell them, while I love doing super aggressive laser procedures, I do have to, make my settings and my treatment options more conservative for my skin of color patients, just because the risk that can be associated with those procedures is so much higher. A lot of times it's a lot of what I have to kind of clarify with my patients is misconceptions on actually, can a laser be used on their skin? I still have a lot of patients who come in and they will tell me, well, I didn't think that lasers could be used on, darker skin types or African American skin. And I tell them, yes, it can. It just needs to be done again by the right board certified dermatologist or practitioner that has that training and expertise to know how to use that laser on skin types. Still, thinking about myths around sunscreens, for melanin-rich patients. That's still something I talk about day in and day out in my clinic. Sunscreens that are going to blend well with their skin. That's something that thankfully we have more options for now, but I still have to educate a lot of patients on which ones may be right for their skin. So I don't mind that patients come to my office, and they want to ask these questions because at least it lets me know that they're curious and they're trying to do their research to find the correct answer. I just usually try to explain to them, in my experience with my training, what I will recommend for their plan and what I think is best based on their concerns. And I usually have to let them know it is going to be a journey. It is not a sprint. The tortoise always wins the race. And so, it may take multiple treatments over a course of months to get to that final result. But the most important thing is that we get to those results safely and effectively.
All right, thank you for that. And now, staying on the topic of laser treatment, which you've talked a lot about this episode, what are some of you talked a little bit about patient considerations. What are some of the important considerations when we're talking about laser treatments for ensuring their safety and effectiveness in skin of color?
Sure. So I think first it definitely will start with, of course, what it is we're trying to address, whether that's going to be post-inflammatory hyperpigmentation, acne scars, or maybe melasma. So kind of identifying what is the primary concern. One of the things I like to do with all of my patients is I always ask to see their old scars. So I want to see a scar when they either burnt themselves on the oven when they were young, learning how to cook, if they fell off their bike, when they were 10 years old and they have an old scrape or cut on their knee, because that also lets me know their degree of hyperpigmentation and how long it may last. And so when I see those scars, from years prior, that allows for me to customize a plan where, again, we may have to do lower energy settings with some of the laser treatments. And again, we may have to space their treatments further apart to minimize their risk of hyperpigmentation. I also like to know what previous treatments have my patients had. Have they done microneedling? Have they done chemical peels? Or have they done maybe milder laser treatments? Because then that lets me know where I can start to make my recommendations. I also like to know, how did they respond to those treatments? Like, once you did the microneedling or the laser treatment, how did you have a lot of redness that was left behind? Did it take you a couple of days to recover? Did you have a week of downtime? These are all questions I like to ask because it allows for me to make those considerations on the laser treatments that I'm going to make for my patients. And also, I like to know about their lifestyle. Are you someone that works from home primarily? You don't necessarily do a lot of driving during the week, or are you maybe a flight attendant or someone that takes a lot of trips for work, or you're, in the planes a lot? Or do you have an adventurous lifestyle where you're always doing hiking trips, or you're outside with your kids a lot at their soccer games or whatnot? These are all concerns that I have to think about because we may have to then plan their treatments either later in the year, after the summer, or when do they have, a good 3 month time frame where they're going to be more at home. So we can kind of, piece together their treatment plan and not have as much interruption either because of their outside sun activities or their traveling activities. Because again, once we do the laser treatments, I always talk to my patients about, as that skin is healing, it's very attractive to the sun. So if we're doing some more aggressive laser treatments and they're getting a lot of sun exposure, the pigment that we're trying to treat could potentially darken because they're getting too much sun on that lasered skin. So I take all of these things into consideration when I customize a plan, because it may be that while we have the plan, prepped out, in July, I may not actually execute that plan until October or November when we have less sun, which is kind of hard here in Texas, but we do our best.
All great background information. Thank you for that. And now, the other type of treatment that you really talked about a lot during this episode is chemical peels. So, sort of on that same tone, how effective and safe are chemical peels in treating cosmetic concerns in skin of color? And what are some key considerations that should be factored in by the dermatologic and medical community in this space?
So absolutely love chemical peels. I think they're partially underutilized for our skin of color or melanin-rich patients, just because I think you can get a lot of bang for your buck. And also, they have a nice entry price point oftentimes for our patients. So I do like to recommend chemical peels a lot, especially for hyperpigmentation, post-inflammatory hyperpigmentation, and melasma. Chemical peels can take you a long way. I usually like to recommend either superficial to maybe very light, medium depth peels. I don't really like to go to medium or deep chemical peels, but the very superficial and the superficial peels we can utilize for our skin of color patients. Things that I like to consider again are going to be, how do they hyperpigment? What does their lifestyle look like? If I'm going to be doing a peel that may have a little bit more peeling involved, then I like to ask, what does their week look like? Are they going to be working from home, or are they still going to be out and about? I like to also know, have they had any prior sun exposure, 2 to 3 weeks before that peel? Because again, I like for their skin to kind of be at a stable, steady state. I don't like for them to be coming in for peels immediately after a beachy vacation, and they're definitely not going on a beachy vacation immediately after their peels. But I think it's a great option, especially for pigmentary concerns with skin of color patients, because now we have lots of different companies that allow for us to combine chemical peels or stack different ingredients on top of each other. And it allows for us to pull off the pigment in a very slow fashion and in a very safe fashion for our melanin-rich patients.
All right, thank you for that. And now, this next question, you've given so many tips, tidbits, and facts throughout this conversation. What do you think is the most important tip you can give to fellow dermatologists or other HCPs about treating cosmetic concerns in skin of color?
So I will say, especially when it comes to chemical peels, microneedling, or and really laser devices or laser treatments for your melanin-rich patients. When in doubt, always do a test spot. It's the easiest way to see how the skin is going to react. Usually I do my test spots behind the ear. I may sometimes do it maybe kind of either behind the shoulder, maybe the elbow crease. But a patient will never fault you for wanting to do a test spot first to see how their skin reacts. A lot of times, my colleagues and I, we will call each other, we will talk about cases. Some of us have the same exact lasers, and we may sometimes, interchange and give each other our laser settings. But again, not every laser is created equal, and not every patient we know is not created equal. So I may take the same settings that one of my colleagues gives me, do it on one of my skin of color patients, and they may have a completely different response than my colleague's patient. So while it is nice that we can definitely collaborate, we can share settings, we can talk about our protocols. When in doubt, or if you're not sure how the patient's skin is going to respond, do a little test spot behind their ear. Make sure that they have someone at home that can help them take pictures and have them take a picture every day of that test spot for the next 1 or 2 weeks. Have them come back in, and then you can look at those pictures together and you can see, okay, is there more redness? Okay, ooh, did this spot turn a little brown? Or, okay, did this spot turn a lot brown? I don't think patients will really get mad if there happens to be a brown spot behind their ear that no one will really know is there except for me and the patient. But if you go ahead and proceed with the treatment that you're not sure about, and there happens to be an adverse event that can really compromise the care you're giving your patient, it compromises the trust that the patient has in you, and it compromises the safety, which is of utmost importance when we're treating our patients.
Very good note to transition to on this next question. But for you, we see a lot on social media dermatologists talking about they wish patients would stop doing X or Y. You mentioned a few things earlier, so interested to hear from you. But what's on your list when I pitch this question to you?
And the question is, what do I wish patients wouldn't do?
Yes.
Oh gosh. Okay. It can be a long list. I'll start with, I wish patients wouldn't show up late for their appointments. It really throws off my schedule, and it's just not nice because I like to try to stay on time as much as I can. Um, I will say I wish patients would really just understand again the importance of sunscreen, especially my skin of color patients. I just think again, we have social media. It's definitely out there, for mass consumption, but I still just get a lot of skin of color patients who think that sunscreen is not for them. I'll say I wish that patients wouldn't bring in a 20 skincare step routine. You do not need 20 steps for your skincare routine. A little bit goes a long way. And I think minimalism with skincare is something that I like to talk about now more than ever, because sometimes you can just have too many cooks in the kitchen and it starts to actually make things worse instead of better. So I usually tell my patients, you can bring in a picture of all of your products, but do not bring in all your products in 3 or 4 Walmart bags, because I'm usually going to tell you to probably take away probably 17 of the 20 products.
All right. And now, just lastly, before we wrap up, what is your best secret to radiant skin? It's clearly not having 20 products, so would love to hear it.
Yes, I will say consistency is really key when it comes to radiant skin. There are a lot of great products out there, and I think definitely seeking out the advice from your board certified dermatologist or your skincare specialist to make sure that you're on the proper regimen is half the battle, because again, there are a lot of products out there. Once you find what works for you, consistency is key. I was just with my girlfriends this past weekend, and they were asking me, they were like, what are you doing for your skin? Like, you have no spots on your skin. And it's funny because I tell them the same routine that you guys saw me doing 5, 6 years ago when we took one of our, vacations, it's the same routine I still do today. So, once you have achieved whatever your skin goals are, and this is the best example I can give you, I tell all my patients, once we have you on your treatment plan for acne and we've got your acne under control, you're no longer getting breakouts, your skin is clear, we're happy. I'm going to keep you on that same plan with your prescriptions for acne because I don't ever want a pimple to come back up on their skin if I can help it. So some people may think once they've achieved their goals that, okay, now they can just go back to doing whatever and they don't have to keep up with a plan. It's just like brushing your teeth every day, but you go to the dentist to get your teeth cleaned. You want to make sure that you have a consistent skincare regimen that is working. And once you achieve your goal, you stay on that plan to maintain the results and maintain radiant skin.
All right. Well, thank you, Dr. Davis. This has been a really phenomenal conversation. Really appreciate you sharing your expertise with us today. To our listeners, we hope you found today's episode informative. If you're interested in learning more about the work of the Skin of Color Society, visit skinofcolorsociety.org. And don't forget to subscribe to HCPLive's newsletters and follow us on social media to stay up to date on the latest in dermatology and more. We'll be back with another episode soon, so be sure to subscribe to Skin of Color Savvy on your favorite podcast platform. Until next time, take care, and thank you for listening.
Thank you.